Welcome back to another Monday Motivations brought to you by Gates Brain Health. Dr. Randall Gates, a board-certified chiropractic neurologist, chiropractic physician, is back with us. And because June is actually Alzheimer's and Brain Health Awareness Month, it's kind of perfect that you're here on this first week first Monday of June, because that's what we're talking about today. Alzheimer's is something you deal with at your practice a lot, right?
Mm-hmm. And I work with a lot of patients who are going into Alzheimer's, who are concerned about their memory. That's really the time, from my standpoint, to catch it, or if you think that you have a genetic risk factor for it, to be proactive to try and cut it off at the pass, so to speak.
And I think we're going to talk a lot about those different factors, but I'd love to kind of understand better, like, what's the difference between Alzheimer's and dementia? Because sometimes I feel like we talk about them interchangeably, but they are different.
They are different. So Alzheimer's is a type of dementia. There are many different types of dementia, but it is the most common type of dementia. So most of the time when you hear somebody who has dementia, they probably have Alzheimer's, but not always.
Okay, so those factors then, let's talk about that. You already mentioned genetics. What role does genetics play in that?
Genetics can be quite important. They're not the entire situation, but they're important because there's something called the ApoE4 gene that's particularly important for most people. And if you have one copy of this gene, you have a 3 to 4 times increased chance of developing Alzheimer's. If you have 2, it's between 8 to 15 times increased chance of developing Alzheimer's. Even if you have the abnormal ApoE4 gene and you have both of those copies, it still doesn't mean that you're destined to have Alzheimer's. It just means that your probabilities are much higher.
Interesting. So then genetics is something you're born with, right? So when do you get tested for that, or when can you?
I would say if you've had a parent with dementia, if you have a grandmother with dementia, a mom with dementia. Also, it's important to note, if you have a mom with dementia, you have a 9 times increased chance of developing dementia versus if your dad has it.
Oh, interesting. Okay.
Because the ApoE4 allele is more conferred through a maternal heritage. So anyways, that's important. And going back to your question was... Yeah,
because kind of like, how do you know when you should be getting tested?
When you should be tested. So I would say if you have a parent with it, a grandmother or grandfather with it, and if you are starting to notice little slips, like you're forgetting where your keys are, you're not remembering names as well, those would be important times to have that discussion with your doctor. Again, none of this is medical advice, but this is my approach. I really try to be proactive with patients, and lots of times patients I don't find are getting exposed to these types of tests, and they're easily done in routine clinical testing. So yeah,
because I mean, oftentimes we get a diagnosis and we get the too late diagnosis, and we're now dealing with symptoms rather than being more proactive about preventing it. And there are lifestyle things that people can do to also decrease their chances of getting Alzheimer's. Is that correct?
That is absolutely correct. So one of the biggest lifestyle factors driving this epidemic, and we're now seeing that Alzheimer's is going up in prevalence. It was, I think right now it's around 6.7 million Americans. It's thought by 2030 to go to 9 million Americans, by 2040 to 12 million Americans. It's in 1 in 9 individuals over 65. So it's quite common. And insulin is one of the biggest factors for driving this biochemical process in the brain of Alzheimer's disease. So insulin resistance, to be specific, which ties in with prediabetes.
Oh, interesting. We've talked about that, about 100%. How a lot of people are kind of considering it a type of diabetes, almost more so than this mental health disease.
And when we look at societally, 30% of our population is pre-diabetic. About 10% is diabetic. That's 40% of adults have a blood sugar issue. And so that's probably one of the main reasons why, not the only reason why, there's many factors. That could be one of the main reasons why. It can be one of the main factors that people can address at home, discussions with their doctors, come see me if you want to do that, to look at your insulin function relative to your brain.
Yeah, there's always an option out there to try and catch a diagnosis early. So Dr. Gates, thank you so much for being here. We appreciate it. Talking about Alzheimer's is always something that can be very, very scary, but we're fortunate enough to have Dr. Gates here to make it a little less so. So we appreciate you taking the time.
Yeah, thanks for having me.
All right, we'll be right back after this quick break.